So, good afternoon, everyone. I am very excited to be here today at our Women's Health Tech Wednesday event, and very pleased to be joined by Dr. Anisha Suri, who is the Associate Director of Data Science at Gilead Pharmaceuticals. And so we're going to have a chat with Dr. Suri today. But before we jump into that, I wanted to highlight some other events that we have coming up in the very near future. Tomorrow, we have our Digital Health Symposium, which will be starting at 11 a.m. through 2 p.m. with some featured speakers, and would like to invite you to attend that event. Additionally, coming up in early May, May 6th through 8th in New York City, we will have a live and in-person event, our annual Innovator Summits, in partnership with New York City Healthcare Innovation Week. So hope that you can also join and attend that as well. Please see the QR code there, and we'll also run that again at the end of the program. But to kick off today's Women's Health Tech Wednesday, would like to announce again, we're joined by Dr. Anisha Suri, who is the Associate Director of Data Science and AI Research at Gilead. And Dr. Suri, would love to kick off the session with you sharing a little background on yourself and how you became interested in life sciences, and that intersection of life sciences and digital.
Yeah, sure. Hi, everyone. I'm Anisha. I'm a data scientist at Gilead, and I've been here for a little over 2 years. Prior to this, I actually started at Gilead as an intern while I was completing my PhD in electrical and computer engineering from University of Pittsburgh. So I had to move from the East Coast to the West Coast. I lived in Pittsburgh for about 4 years, doing research on gait and mobility analysis using wearable technology, so all sorts of sensors to understand mobility of older adults and how clinical trials change their patterns and how they relate to different social and environmental aspects as we age and in place. And so I grew up in Delhi, my hometown in India, and I attended an undergrad university. It was all women's university, and that's where I first studied electronics and communication engineering. And I got very interested in signal and image processing and wanted to understand. I was good at math, so that kind of helped to understand how the computers work, the functioning of algorithms. Then came to the US to do my master's and eventually worked in research labs related to neuroimaging. So got very interested in healthcare applications of ML technologies. Taught myself Python and other programming languages, and that's how I came into the intersection of data science and healthcare, and in right now in my role.
Fantastic. And also really interesting and inspiring that you went to an all-girls university back when you were in your home country of India. And I don't know, any perspectives you can share just attending the university that was all female?
Yeah, I mean, I went to a co-ed school, right? When like high school, so it was kind of a unique change to be around all girls and all of them so smart, right? It was a class of 75 of us and coming from unique backgrounds and not just from Delhi, from all over places in India, and all driven so much to make a change and to learn and to grow and to build. Like we had like robotic teams, we had so many other initiatives, organized technical fests, and build robots, and participated in contests all around. It was a unique experience, but we didn't feel like like that. Like so-called like privileged, because we used to compete with contests where only like guys would show up, bringing their
Mm-hmm.
heavy robots and stuff. uh, it could feel a little intimidating, but we took our space, and we participated in full spirit, and it was great learning experience. The teachers or the instructors were both male, female, very encouraging, and bringing in unique projects for us, and uh, it was a pretty fostering atmosphere.
That's great. And of course, it's kind of the anchor too. We're always excited to hear about women in technology, especially health tech technology as a part of Hit Lab. So it's really nice to see the commitment to the STEM area that you grew up in and how you've been able to bring it here to the US and take that engineering training that you have and pull it into the life sciences in support of both men and women. And can you share a little bit about the work that you're doing at Gilead and where you're focusing sort of your expertise in engineering plus life sciences?
Yeah, absolutely. So currently, my role is to support clinical operations and other clinical development teams to optimize clinical trials, to do feasibility analysis of the sites we should go to, the countries we should target, and optimize the protocols to inform which patient segments are critical to go, where is the disease prevalent, and all these kind of in data-driven way. So we use the internal historical clinical trials data and combined with the public information, like from websites like clinicaltrials.gov, and bringing in insights for the teams so that you can make more informed decisions based on data driven approaches, or even like validate your own preferences, because how clinical trials happen. And the other aspect is to participate with a real world evidence and medical affairs team, and inform like diagnosis of certain disease areas. So using the real world data sources, and seeing the patterns in the patient diagnosis, and come up with risk factors to diagnose certain diseases early on, so we can prioritize screening of patients accordingly. Yeah.
That's great. That's really very interesting. And it's really interesting to see how you are, to hear about how you're combining the clinical data or the clinical trial data that's captured in a controlled setting with the real world data, because as we know, the clinical trials are critically important to get the validation of efficacy and safety, but the real world introduces elements that aren't necessarily in a controlled setting. And so it's really important that we bring these things together to really try to optimize the solutions and the outcomes we hope to have with them. So can you share a little bit, everybody right now is the topic is AI or machine learning. Can you talk a little bit about how you are leveraging these? They're really not emerging innovation areas anymore. They're really embedded. But how are you using these advanced learning innovations in the work that you're doing?
So we can, like, the algorithms have existed, as you mentioned, for a longer time. But right now is then we are realizing the potential or the computational power is so strong that we can actually use them in the applications. But again, with great power comes great responsibility, and it's not that the solutions are always like scalable. So they start as like a POC, and just to understand how the what the patterns in the data are. And there are various methods that you can use, and there are various toolkits that are offered by open source programming languages like Python. And you can apply those tree-based algorithms, understand like what the predictors are for your, like valuable output. So it could be like, diagnosis of, say, a certain kind of hepatitis, or like predicting when like a patient is going to like or how long it will take for them to get treated, things like that. And that will combine both patient demographics as well as the clinical information, or what journey they have had, right, with the procedures, with diagnosis, and with the kind of medications they are taking. And so all of this data can you can leverage. It's hard to do it manually, right? And understanding all these different features. So these algorithms are helping us to find patterns, hidden patterns, or in how the disease risk or treatment plans are developed.
And are you seeing any differences when I mean, as it relates to, as you talk about women's health, women focused outcomes or women focused clinical trials, are you able to use any of these technologies specifically in the female focused areas?
Yes, so like when I say that we are building the models and we are understanding the predictors, so the models, especially in healthcare, they don't have to be black box anymore. You can't build trust around any model that is not explainable. So interpretable models are very important, and some of the times when you are analyzing the feature importances, like what is playing, a critical role, gender, race, or such constructs stand out. And then, so that's not where you have to stop. You have to go one step further and assess that maybe this model is not generalizable enough to all sorts of constructs, and we have to do some kind of post hoc analysis or adjust the model weights so that it is catering to all the constructs or the ones that are of interest. And especially in women focused trials, like an example that stands out is the breast oncology, right? Like a lot of, so historically we have to understand that women have been underrepresented in the clinical trials, and over the years, so the clinical trial data is not capturing like these gaps in the sex differences already. So if you train your models on such data points, of course, the bias will be reflected, and you can't build like trust around that models. So, and you can't go back in time to fix that data, but you can do is become intentional about like what kind of data you are using for your model. Are there any techniques? There are a lot of techniques to oversample the minority population, so you create like a balanced data set before you do the model training. Or like be careful about what kind of data you are putting right there, right? Like, or how can you augment it using these other different features. Yeah, I think it's very critical to see what kind of problem you're solving. And there was this recent research study which mentioned that cardiovascular diseases, they are like being misdiagnosed for women for a long time, and even after using these AI/ML, because the data that they were trained on are primarily like men samples. So what do you expect, right? So understanding that there are nuances in the risk factors or how we respond to treatments, like or the side effects, the reactions, all this has to come not like after the drug is launched, like just considering women as smaller like counterparts to men and then just optimizing the dose accordingly is not a solution. Like we have to build it for them, not like build a drug and then do the analysis for special women needs, like pregnant women or women who are breastfeeding, or so. And especially like communicable infectious disease, it becomes really important that the intentions are really right, because it's the next generation that they could pass on the things to, right, if they catch the infection in that state. So I think we need more trials, more research, and the right intentions to include women and women of all backgrounds, right? Like there have also been differences on like clinical trials on contraceptive pills, as an example, that they were tested first of all on both male and females, right, when the pills were developed, and then also from for women, like especially coming from like minorities or like poorer backgrounds, and those biases have also been existed. So all these kind of constructs, society is complex, and we have to like acknowledge that, right? But how these intersect and how these differences interact are also very important. Like you can't isolate these constructs as such, right? So yeah, I'll stop here, but I think those were like a lot of ideas that were going on in my head to share.
Well, you touched on a lot of really important aspects as we think about women's health. The fact that, women have been underrepresented in clinical trials from very early days in light of, there are very specific reasons for that in light of childbearing and hormones and things like that. But because of that, we are, there isn't it there we don't have a good understanding as we don't have as good an understanding as we do with the male population. And there, I think you shared a number of interesting ways to think about mitigating those gender biases as we move forward to build on more reliable information that does support women specifically. But then there are the permutation, well, sort of the different, every woman is different, and based on their genetic background, obviously, but also their race and their ethnicity. So there are those considerations. So it's very good and reassuring to hear that organizations like Gilead and the work that you're doing are very much focused on trying to better understand those differences and balance those out in the work that you're doing moving forward. So kudos to you on that, because it's much needed. And it's good to hear that that is a priority for sure. And I know that you do a lot of work in the wearable technology space and have a passion in that area as we think about digital health and support. Can you share your perspective on where you see wearables transforming women's health or just health in general in the coming years?
Yeah, absolutely. I think there are more digital sensors or wearables on this planet than the humans themselves, you know. And it's been exponentially growing, and all big companies are jumping into the wearable market. But we like I see like the use of wearables becoming more personalized, or being able to catch that difference, that nuances in the differences that you have in activity patterns, like over the weeks. So like if somebody was, maybe taking 8,000, 10,000 steps a day, and suddenly in upcoming weeks, you see that their levels have gone down to like 5,000, 4,000. So maybe like a trigger then that goes to like a feedback that goes to their provider, just to say that, oh,
There's a
something
flag, right?
something is up. Yeah, right. So creating those, like as an example, flags to the provider, and increasing engagement in that sense, that, it's automatic, right? And the providers, instead of just not most of the time they're just spending, taking notes and stuff, there would be like automation, so that they can actually, we can actually put the care back in healthcare, so to say, right? Like, so the
Yes.
engagement piece is going to be very important. And particularly for women health, like I think so many algorithms are now these days developed, including the ones that can help you monitor your like ovulation cycle, just plan your activities around it, and understand the differences, even like things like your mental health, your stress levels, and your nutrition. So all these aspects kind of coming together, and helping you live a very physical, socially, and emotionally balanced life. I think that's where we are headed. And these are going to become accessible and cheaper for sure, because if we don't want the technology to widen the existing gaps that are existing in our society, right? So I think like a lot of effort has to come into bridging those gaps with increasing accessibility of these technologies, and involving the right stakeholders, and in remote places where specialized care can't be reached, maybe technology like this will help supplement and connect, those dots. And uh,
Yeah.
so I think that's where, at least I think, where we are heading, or should be heading, you know, uh,
Yeah.
for both women and men, healthcare.
Overall, yeah, and I think, like you said, kind of putting the health back into healthcare and focusing more on wellness, supporting prevention. If we can leverage technology to monitor remotely and then send out those flags earlier to prevent if
Yeah.
it's a mobility thing, preventing a fall or seeing that something's going on, they need to come in and there's something has changed that needs to be looked at. It supports that more preventive care and wellness model versus the sick care or the model that we currently have. So
Yeah, or I do want to add, like, the event detections, like fall risk models or falls that older people experience. So for different age groups, these the priorities will be different, and that's what I see these variables to be like personalized towards. So if a person is above certain age group and they are more prone to, like, cognitive issues or experiencing like a fall which can be life threatening, right? So
yes.
creating those feedback loops across the population and across these different uh, aspects, as we grow, our needs are different and priorities are different. So I think those kind of models, maybe 5 years is too early, but yes,
Yes, but 5 years goes fast, so you never know what's going to happen,
yes.
and the future is now in a lot of ways. So, how do So, with your background in engineering and the deep science side of things, and the work that you're doing, it's all there to support the human being, the person. So, how do you balance the deep technical scientific expertise that you have with being able to deliver on the human-centered need? How do you balance that, and how do you solve for that?
Wow, that's an excellent question. Um, like humans are involved in all parts of the process, and we have to understand that, it's people say like human in the loop, and I heard somewhere in another conference, and I really held on to the idea about like AI in the loop. Like, how about that? Like it's all about humans, and then AI is just a component in it, right? So
Right.
I like that approach better. And so we have, like, we have to understand that at what pieces are we involving our stakeholders or the clinicians, who are we building it for. Those always have to be at the center of understanding. Like, if they don't understand it, they will not use it. So the user, be it your patient, your healthcare provider, or whoever you're building the tool with, if you have to be intentional about involving them at this, not just at the start and the end of the process, but throughout, right? Like
Yeah,
keeping them involved and seeking like those that domain expertise, which will never go out of fashion, right? And patient knows their disease the best, like nobody else does. You can build models, you can do whatever. So I think, like, I am a little bit farther from the direct interaction with the patients, but when I am building something or writing code, or like coming together with my teammates discussing, like we always think that, imagine there is like a patient in the room. So like keep all your things aside, like what are you building and how are it's going to benefit them, right?
right.
That's really important. And becoming intent, really, like, it's all about the intentions. Like, you can build models, do whatever, but how um, you can make it scalable or acceptable, user acceptance, or because you can build and it can just sit there, nobody's going to use it. So
That's right, and there have been a lot of examples of that where it could be something really amazing, but if nobody's going to use it, because it doesn't fit within the way they live their life,
yeah.
that's the reality. That's the difference between the clinical trial setting and the real world, and the real challenge that we have in healthcare in balancing those two things, because it doesn't matter if something's just efficacious and safe. If it isn't being used properly in everyday life, we don't get the optimal benefit out of it. So
Yeah,
have
don't we get like frustrated if you're not able to figure out how to use an app? We don't go back to it, right? Like we have things that we keep going back to only
yes,
because we find it like useful, and so
yes,
that is important. Like sometimes the variables are not working, and who would think like it's the band. The band is causing irritation to certain kinds of skins. Like,
right.
would we have predicted that? No, like only when you involve them, have that feedback, including those kind of questions and assessments early on in the process is so critical.
Agree. Yeah, again, I think that's a great way to kind of kind of close that thought out that as you're building, if you as you're leveraging the technology and building for the human being, you know, include that voice at the very beginning throughout and keep it, it isn't just like you said at the beginning and the end, it's throughout the entire process. So
Yeah.
really important point. And I know we're just about the top of time, but I wanted to ask you one more question that you clearly have such an impressive background and a very inspirational um, you know, approach, your education, your background, your um, you know, kind of your global reach, growing up in India, coming to the US to really help build the healthcare ecosystem here. What advice would you give to other women in technology, in the engineering space, in the sciences, or anybody in general who's looking to make an impact in healthcare?
Yeah, no, thank you. I feel like education sometimes is a privilege. Sometimes it's also the home atmospheres that push you towards, like, both my parents are educators and they were really big on getting educated. But my grandma didn't go to school, but she always used to keep saying that, study well, get good scores, and work hard. Uh, but as for the women, who are starting off or want to get started into healthcare, or if they are somewhere and they want to transition into like data and science related fields, I think it's so important to build computational skills, learn Python. These days it's so easy with these
Mhm.
interactive chatbots to just pick up on a programming language. But your
Yep.
computational skills, your problem solving skills, and uh, being able to communicate, the problem and the solution in an understandable manner to non-technical folks, I think those are like priceless skills to build. And those skills nobody will be able to take from you, right? Like, so you have, like, I think investing in that is very important. And then of course, seeking a mentorship, reaching out. Everybody is trying to make it, and people are very open to helping. And so many open source platforms are available, like HitLab being one such platform to connect
Mhm.
and discuss or maybe make plans. And it's like I think it's not we shouldn't overwhelm ourselves that, oh, this is so far, technology has progressed so far, I'll never be able to catch up, because every day new models are coming. It's very hard to keep up with everything, but starting somewhere is important. So,
Right.
so just picking up some technical skills and then finding the right domain that you want to fit in. And there's so much work to do. We need more women data science, in the field. So
Amen to that. 100%. And, I just want to thank you so much. And I would say your parents must be very proud of you. You have studied hard, you have worked hard, and you've been very successful. We are excited to have the opportunity to partner with you and are very excited to continue that collaboration and watch you as you continue in your career and really appreciate you sharing. I'm seeing a lot of really great feedback in the chat. And, would just let the audience know that feel free to reach out to Dr. Suri on LinkedIn, or me as well. And thank you so much again for joining the conversation. We'd love to have you back another time. And would like to just share with the audience that Women's Health Tech Wednesdays happens every Wednesday. We have another one coming up next Wednesday. We'd love to invite you to join us for that. I'd like to thank all of our sponsors that are a part of our programming. And again, a very special thank you to Dr. Anisha Suri. Amazing work. Keep up the good work. And you're an inspiration. And we would love to have you join us again.